It's said the most important thing in life is good health. But our nation's and our region's health is not so good. And it's not an exaggeration to say that our health is at a tipping point. Healthcare consumes 18% of our country's gross domestic product, or $3 trillion a year, and costs have risen steadily for decades. I suspect many of you would agree that these costs seem unsustainable and are overwhelming for families and businesses. Politically, the healthcare policy debates are divisive. Health is seen as a commodity rather than a human right. And we tolerate the fact that millions don't have access to health care that they can afford. U.S. health statistics are worse than dozens of other countries, many less developed and with far fewer resources than our nation. And we should all be heartbroken that for the first time in modern American history, it's predicted that our youth may have a shorter life expectancy than their parents. Locally, we struggle with an opioid epidemic and a chronic disease burden that's similar to or even worse than surrounding states. And there are large disparities between who has decent health and who has poor health, right here in southwestern New Hampshire. Yet a decade ago, our community's leaders pledged to help the Monadnock region become the healthiest community in the nation. So let me tell you about what I've discovered on my journey as an advocate for health and how I believe we need to tip things towards better health. More than 25 years ago, I trained to become an OBGYN physician at two prestigious private universities. Now I can say they're prestigious because I recently looked them up and I found out that they're still in the top 15 medical schools in the country. In the flagship hospital of my medical school was nearly 20 stories tall. And I was impressed. If my mother were still alive, I know she'd hope you'd be impressed too. But I was also impressionable. And I came away from my education with a picture for how it seemed the medical establishment felt it best to use our nation's vast resources to improve health. See, I learned that we needed more scientific medical education, and we needed cutting-edge techniques and surgeries. And it's hard to argue that because diseases and treatments are so complicated. We needed more research and development of new medications to combat the major killers like heart disease and cancer and diabetes. And we needed to be tireless in working to find that silver bullet, that cure that's just around the corner waiting to be discovered. We need a more sophisticated medical imaging technology. I mean, CAT scans are good, but aren't MRIs even better? And what about those amazing PET scanners? And why can't we just swallow a little tiny camera and let it visualize trouble as it makes its way through, from the top and out the bottom, if you know what I mean, right? And we needed doctors, more doctors and nurses. There always seems to be a shortage of doctors and nurses. And we needed more hospital rooms and emergency rooms and urgent care centers. We needed a handle on medical information, right? We needed an electronic medical record where every detail of a patient's medical history is just a few clicks away. Maybe we could even implant a little chip in the skin of everyone, and then we'd have our medical history with us. Now, how cool would that be? My wife, Heidi, who's also an OBGYN, and I, we were dutiful in preparing to be medical healers. We kept these little books in the pockets of our white coats. We called those our peripheral brains, because you needed them, because you couldn't possibly remember all that scientific information and medication dosing. And of course, the iPad hadn't been invented back then, so we didn't have that, which is all of your peripheral brains now. Right? See, we've been led to believe that outstanding medical care is all that's needed to ensure good health. But you want to know a secret? It's a secret I began to uncover as a conscientious obstetrician who felt like most of my practice became rescuing people who were in health crisis. That medical model of health is mostly a lie. If we want to achieve better health, we need to look beyond medical care. Now, sure, you need high-quality medical science, and you need competent health professionals. But even the most generous figures estimate that no more than 15 to 20% of our overall health is the result of excellent clinical care. The other 80% is everything else in our lives. How and where we live. The education we get. The jobs we have and the incomes we earn. The safety and cooperation in our communities. The people we surround ourselves with every day. Those are the things that matter. See, we really don't need more health care. I believe we need to care more about each other's health. Because health is created in the community, where we connect with and we help one another. Doctors and hospitals alone don't hold the key to health. We do. So this is a call to action to everyone out there. Each and every one of us has the power to tip our nation, our community, and our world toward better health. Because it turns out, health is actually created in the home, where families express love and feel cared about, where breastfeeding is encouraged, where parents and grandparents are attentive to their children and are eating together around a dinner table, and they're talking face to face rather than texting each other even when they're in the same room, right? Because protective factors like that reduce risk and lead to healthy development and well-being for children and families. Health is created in our neighborhoods, having affordable housing, knowing your neighbors, having sidewalks and safe places to walk and play, caring about each other's children like they're your own, paying them to rake the leaves and shovel driveways, things like that. Health is created in schools, where kids walk and bike to school. They're eager and prepared to learn. They eat wholesome foods. They play and exercise. And they're mentored by caring adults who are not even their parents. It's created in our businesses, where we do meaningful work. We're not overly stressed. And we're paid a living wage. Not today's minimum wage, because today's minimum wage is actually an unhealthy wage. We don't sit all day, because being sedentary is sort of the new tobacco. And it's created in our clubs and our places of worship, where we make friends and we can be of service to each other. Because a group of friends at a Rotary Club breakfast or a church social, that beats 500 friends on Facebook. Because research has shown that only a very small number of those virtual friends can be counted on in tough times. Health is also supported in our society, where our laws and our policies keep our public spaces tobacco-free, reduce gun violence, ensure a safety net for those less fortunate, address climate change, keep our air and water clean. Because when we come together, we create a shared culture of health. And we're less likely to be complacent with injustice and disparity, because what challenges you also challenges me. And we're in luck, because it's in our nature to be cooperative and altruistic and socially connected. But unfortunately, life can be lonely and it can be disconnected, and seems to be getting more so. And social isolation is life-threatening. So what can we do? Turns out we know the cure. Strong family ties, friendships, participation in social events and gatherings such as today's event, affiliation with civic organizations, belonging to religious congregations, they all matter. Because living, breathing human beings help when things go wrong. Helping relationships are essential. If you're making a change, tell someone about it and enlist their help. Positive relationships and attachments contribute to satisfaction with life and happiness much more than money or fame or having possessions. And happiness helps us live longer and better. Small things you do for others, in your family, schools, workplaces, it can have ripple effects. Cooperation, charity, healthy lifestyles, they can all spread throughout the community. Kindness and caring could become our social norm. Here's the key to health that was overlooked in my medical education. Connect with someone. Invite someone to connect with you. Care about someone else's health as well as your own. Join a group doing anything that interests you. Call an old friend. Adopt a pet. Volunteer. Join a support group. See, we need to rekindle the power of conversation, not debate. We have enough of that. We need to engage in genuine, reciprocal conversation. Learn about others. Become a good listener, especially with your significant other, right? And your children. Build trust, show respect. Heal a broken relationship by practicing forgiveness. In the act of forgiveness, we're helping ourselves. We're not letting someone who hurt us off the hook. It may be a bitter pill to swallow for health professionals to know that medical science alone does not hold the key to fixing what ails us. Instead, it's all of us, starting with the people that are sitting next to you in this audience today, who, working together, can tip us towards better health. So in the coming weeks, as you sit with family and friends, talk and eat together, hopefully become advocates for health in our political system, you'll be practicing the best medicine there is. Much more powerful medicine than I ever practiced as a physician. You'll be expanding your social connections. You'll be building social capital. You'll begin to confront the social issues and inequalities that keep all of us from reaching our full potential. You see, we can achieve better health by working together. And I believe that together we can create and live in the nation's healthiest community. Thank you.